You might think obesity just means being overweight, right? But when it becomes severe, it can silently damage almost every organ in your body from head to toe. Hi, I'm Dr. Amit Goswami, a laparoscopic and bariatric surgeon with over 2 decades of experience. And today we'll talk about what happens when obesity reaches that dangerous point and why it is not just about appearance, it's about survival. Before we begin, please like, share, and subscribe. Your one click helps us spread real, science-based health awareness to thousands of people. Understanding severe obesity. When we talk about severe or morbid obesity, we are usually referring to a patient of BMI of 35 and above. And that's when complications start multiplying. At this stage, fat isn't just stored under the skin, it starts to accumulate around your vital organs, your liver, heart, and even inside your muscles. This internal fat, known as visceral fat, becomes metabolically active, releasing hormones and inflammatory chemicals that disrupt normal body function, leading to serious medical conditions. Let's understand some of the most dangerous complications that often go unnoticed. Non-alcoholic fatty liver disease, NAFLD. One of the first organs to suffer is your liver. Excess fat starts depositing in liver cells, leading to a condition called non-alcoholic fatty liver disease, even if you never drink alcohol. Over time, this can progress to liver inflammation, scarring, and even cirrhosis. What is scary is there is no obvious symptoms until the damage is advanced. The liver is your body's detox factory. Once it's overloaded with fat, everything from metabolism to energy level is affected. Second is obstructive sleep apnea. Another silent but dangerous complication is obstructive sleep apnea or OSA. When there is too much fat around the neck and chest, your airway can collapse while sleeping, leading to snoring, interrupted breathing, and poor oxygen levels at night. This doesn't just cause daytime fatigue or poor concentration, but it also puts a massive strain on your heart and blood pressure, increasing the risk of heart attack and stroke. So, if you snore loudly or wake up tired despite 8 hours of sleep, don't ignore it. It could be a sign of severe obesity affecting your breathing. Third is joint degeneration and mobility issues. Then comes your joint, especially the knees, hip, and spine. Every extra 1 kg of body weight puts almost 4 kg of extra pressure on your knees. Over time, this leads to joint degeneration, arthritis, and chronic pain, making movement harder, which then causes further weight gain. It's a painful cycle. Limited activity leads to more fat gain, which leads to more pain. Breaking this cycle early is essential. Increased cancer risk. Few people know that obesity also increases the risk of certain cancer, for example, breast, colon, uterine cancers, pancreatic, and liver cancers. Why? Because excess fat tissue releases estrogen and inflammatory substances that promote abnormal cell growth. This means severe obesity isn't just about weight, it's a metabolic condition that fuels disease at a cellular level. So, if you have noticed snoring, fatigue, joint pain, or abnormal test results, those could be signs that obesity is already affecting your organs. But the good news is, with early medical evaluation, lifestyle changes, and modern treatments like bariatric surgery, most of these damage can be prevented or reversed. If this video helped you understand the real dangers of severe obesity, please like, share, and subscribe. Your support truly helps to spread awareness. It motivates us to keep creating more content that can change lives. Always remember, it's not about how you look, it's about how you live. Take charge early. Your health is the strongest investment. Thank you.